Good evening. Thank you all for stopping by. Here I am back in my dungeon gym to do another one of my videos. I know it's not the best. You can see the floor joist above me, but this is my sanctuary in my home, okay? I have quite a bit of room down here in my basement, and as you can see, part of this is my personal gym area, so is the other part. But what I'm going to do tonight, I'm going to make a confession to each and every one of you. But before I do that, I want to talk about the word hate, because they say hate is a very strong word and that you should never use it. For example, if I were to say to you that I dislike a certain individual, that's different than saying that I hate the person. If I say that I hate the person, then I've taken that to an all new level. So it's not very nice. And we've all been taught that you really should never say that you hate somebody or that you hate something. Now that I've lectured you on the word hate, I'm going to make a confession. Here it is, my confession to all of you. I hate Fioricet. I hate Furanol. I hate any combination analgesic that contains Butalbital. Brand names, generics, the stuff from wholesale pharmacies. Across the board, I hate them all. Take a nice breath. I got that off my chest. Feels good to get that off my chest. And you know what's worse? I have no shame, none whatsoever, in admitting to all of you that I hate anything containing Butalbital. But if you don't mind, I'd like to provide a reasonable explanation as to how it is I've come to actually hate something. In the Western world, we practice evidence-based medicine. And if you say that there is a level of evidence for a certain drug, the strongest level of evidence is the following: a randomized, double-blinded, placebo-controlled trial. In other words, if I were to claim to you that sumatriptan, the brand name Imitrex, is effective at aborting a migraine, if you were to say to me, well, what's the evidence? If I were able to show to you that there was actually a medical study where there was a placebo group and an experimental group, and the experimental group outperformed the placebo group with statistical significance, then sumatriptan gets a stamp and a seal of approval, because we have done a randomized, double-blinded, placebo-controlled trial which showed that sumatriptan was better than placebo at aborting a migraine. Now, there are no randomized, double-blinded, placebo-controlled trials which demonstrate that anything containing Butalbital, Fioricet, Furanol, not any of those medications, aborts a migraine. There's not one study of that caliber. In other words, there's no medical evidence that these medications abort or rescue a migraine. I'd also like to explain to all of you why these medications cause a downward spiral and place a patient in peril. If you break down that medication for each of its little components, part of the medication are analgesics, things like acetaminophen, aspirin, sometimes codeine, a little bit of caffeine. And the other part is a long-acting barbiturate. So here's the problem. If you take the medication, it the analgesic component of it might take the edge off of your headache, but it's very short acting. While that barbiturate component is long acting. So really all you're doing is making a zombie out of yourself. Because 4 hours later, when your headache comes back, and it will, and you take another medication, the analgesic part might be nearly out of your system, but that barbiturate component's hanging on. Now you just added more, you added more, you added more, while the analgesic component's not really catching up. Now, I've heard every argument in existence with my patients, but it's the only thing that works. Look, if that medication was working, you wouldn't be in my office with chronic daily headache. Stop and think about that. You have chronic daily headache. How can you say that medication works? Here's what you're doing. Every day you wake up, immediately you have a headache. Immediately you reach for your Fioricet. Again, it might take the edge off of it, but the headache never really completely goes away. 4 hours later, you do it again. 4 hours later, you do it again. You change the chemistry. You change your body's chemistry, where you have converted to what we used to call transform migraine. Rebound headache, the layman's term. You've changed the chemistry so much that even if I prescribe to you a medication that does have good medical evidence behind it, it may not work. You presented quite a challenge to a person such as myself if you're in that situation. The other thing about those medications, there is some medical research behind those which show that individuals who suffer from anxiety enjoy overusing those medications. My theory is the barbiturate component probably treats their anxiety to some degree, but again, is that really how you want to treat your anxiety, by making a zombie out of yourself? And as you know, many patients that I see with migraine, particularly chronic migraine, suffer from anxiety. I'm setting you up for failure if I prescribe you this medication. There's a place in the Boston area called the Graham Headache Center. There are individuals on staff there that are world-renowned headache doctors. People such as Elizabeth Loader. She's a goddess in our business, okay? When the Graham Headache Center started up, Harvard affiliated, by the way, for what that's worth to you all. When the Graham Headache Center started, it had a nickname. The nickname was the house that Fiorinol built. In other words, the implication there was that if it wasn't for Fiorinol, maybe they would not have had to carve out a specialty headache center. Now, here's the other issue with this medication. Well, let me just back up here for a moment. Do you know how many patients I've seen in my career that when they come to my office with a prescription for Fioricet in their hand from their other doctor, do you know how many patients I've seen in that category that are not overusing the Fioricet? You probably think I'm going to say none. Truthfully, I've kept count. 3. I've seen 3 individuals in my entire career that came to my office with a prescription for Fioricet that did not overuse Fioricet. On a personal note, I know some of you think I haven't been practicing very long. I've been practicing neurology since 2005. That's really when I first entered residency for neurology. So I've been seeing these patients since 2005. So have I been doing this for 40 years? No. But especially in my career, for what I do for a living, especially since early in my career, I was a military neurologist. Can you imagine how many headache patients I've seen when I was a military neurologist? Out of all those patients I've seen over my career, I can count on one hand the number of individuals that did not overuse Fioricet. I'll make another confession to you. What drives me crazy? I've just spent the last 10 minutes or so explaining to you why these medications with Butalbital are not appropriate for migraine. Don't think that if a patient backs me into a corner that I won't spend 10 minutes or more explaining the same problem. So after I spend all that time explaining why it's a quote-unquote bad drug and why I'm not going to prescribe it, I'll come up with an alternative plan. I'll walk out of the room, I'll sit down at my computer, start getting ready to type in some orders on that patient, and then the office staff will come and say, hey, I'm checking the patient out and they want to know if you're going to refill their prescription for Fioricet. It's almost as if everything I just said was completely unheard. Please hear this. This is a bad drug. This is a drug that should not be prescribed for migraine. A few years ago, I went to the American Headache Society. We had a lecture by Hans Diener, a internationally recognized headache specialist from Germany. And he got up to the podium in front of everybody and he said, I can't understand you Americans. You can put a man on the moon, you Americans, but you can't get Fioricet off your formularies. I don't understand it either. If you go to your prescription plan's website and search the formulary, you'll find things with Butalbital under headache drugs. But here I am explaining to you why it's a bad drug, and so you're probably scratching your head thinking, well, why would my insurance company allow it? Well, there's a couple of unfortunate things, okay? In medicine, we have rules, and then in medicine, we break rules all the time. Sometimes there's paradigms and conventions we follow. In the primary care world, for individuals who go through training with family medicine and internal medicine, pediatrics, their mentors prescribe Fioricet for migraine, so they do it as well, right? Somewhere in the world right now, there's a family medicine resident who's in their first year of residency who is staffing a headache case with his or her attending, and the attending says, prescribe that patient Fioricet. Even if they know better, even if they've been provided with the knowledge that I just gave to all of you, their attending will say, oh, I've been doing this 30, 40 years and blah, blah, blah. Egos are a little tough in medicine. The other thing is this, okay, for what it's worth, when I have to do a peer-to-peer review with your insurance company, think about what that means, peer-to-peer. Do you think I ever get a neurologist on the line to do a peer-to-peer review with? Now, I make mention of this because if I lecture you or my patients in the office about why this is a bad drug, they might misunderstand what I'm saying. They might believe that I'm calling their primary care doctor stupid or that I'm accusing their primary care doctor malpractice. That's not what I'm doing. I understand that it's convention in their world to prescribe Fioricet for migraine. Their mentors did it. They did it. It's become a paradigm. Guys like me, neurologists or physicians from other specialties that enjoy seeing headache, we have a very difficult time breaking that paradigm. I wish we could. We're one of those specialties that doesn't make very much headway. For example, your primary care doctor knows that diabetes and hypertension are bad for your health. They know that if they don't treat those conditions, that you could have bad vascular disease, strokes, heart attacks. They'll lecture you. They'll get on your case about those things. When it comes to headaches, there are good studies out there that show that the education for doctors going through graduate medical training, their residency programs, it's lacking. It's not enough. And I blame that. So there you have it. My story as to why things with Fioricet or Butalbital containing agents are bad for migraine and why I just won't prescribe them. Now, if you are a patient who's overusing these medications and I'm refusing to prescribe it to you, well, what should you do? Well, there are some things you can do. But first of all, you can taper off the medication. Okay, so if you take 4 tablets a day, maybe for 5 days, take 3 tablets. And then maybe for the next day, 5 days, take 2 tablets. And then the next 5 days, take 1 and then stop. Slowly taper. That's a hypothetical example, by the way. Please seek official advice from your physician before you do that. Now, in the years that I've been practicing neurology, do you know how many patients that I have counseled to taper off a Fioricet that actually followed through and did it? This time, I am going to say none. It's never happened. They just can't get rid of it. Another strategy is to stop cold turkey, but provide you with a phenobarbital taper, which I think is a little bit more effective. For what it's worth, if you do suddenly stop these medications containing Butalbital, you could have a severe withdrawal reaction. So please don't do that. Okay. So if I got into your head, if you're somebody out there who's frequently using Fioricet or overusing it, and I got through to you, please don't just stop the medication cold turkey. Seek appropriate advice from your physician as to how to taper off the medication, or ask for a phenobarbital taper. I will warn you this: if you seek appropriate therapies for migraine, they won't work until you are off that Fioricet. Well, thank you for stopping by my dungeon. I like it. And thank you for listening. I will do more videos like this in the future. And I wish you all good health.